It's just a expression of what the feeling of grief and loss is about. Heart wrenching. I think that for me, having done all different parts of hospice care, I think bereavement work is the heaviest because even though we can palliate some symptoms for patients, it's much harder to palliate grief. The one tool that we have for doing that is to acknowledge, validate, and receive people's grief. So in the grief groups or grief counseling, family members are sharing the heaviness, like you saw in the video, the heaviness of that process of trying to let go and feel like everything is different and the world is different. And I'm imagining that we've all had grief in our lives and we know what that feels like. It isn't something that we can take lightly in ourselves or in other people, and it's one of the heavy things that it's all right. I feel the same way. I'm holding myself together for the sake of standing here, but I certainly am feeling it, So when we're thinking about grief, we're thinking about that from the very beginning of a case that we have in hospice. That we're thinking about the family and how they're going to do, and the patient and how they're going to do with the losses that they're having, the anticipatory loss for themselves and for their family members. So some of the ways of thinking about grief, our culture does a horrible job with grief and bereavement, by the way. So we have to remind ourselves it's not a disorder. It's not a disease. It's not a sign of weakness. It's an emotional, physical, and spiritual necessity, the price you pay for love. And the only cure for grief is to grieve. So oftentimes in our grief groups or when we visit people, they are upset with themselves for grieving.
Can you throw the tissues over?
Certainly.
Yeah.
Yeah. This will be the harder part. And it's when I started as the director here, and I gave the grief groups to over to Guy, I was very relieved actually, because having done it for a while, it's like that's heavy stuff, and I have to go home and recuperate from a grief group, with Medicare, rightly so, we're asking, we do a bereavement assessment at the beginning of every case. We look at the family, we look at the patient, we look at whoever's there. In this case, we were just talking about with a daughter who's youngish, she has autism. We're going to be watching to see how she's processing that. A lot of stress, a lot of family dynamics. So there's that complicates things. And the next quote that I have there by Maya Angelou, there's no greater agony than bearing an untold story inside of you. So a lot of what grief is listening to the story. Kind of like when you listen to the story of someone having a birth and they want me to tell you the whole story, whether it's traumatic or beautiful, the same thing with a death. They need to say out loud, he never got comfortable. Or I felt like I killed him with that last dose of morphine. Or his daughter was on her way and didn't make it. Whatever the losses and sadnesses. And so for nurses, you're going to be walking along watching for signs of that. The non-nursing staff is going to be walking along trying to intervene. Are there people in the family we can reach out to? Do we want to connect someone who lives far away with grief support in their area? Do we want to certainly talk to the patient about their own anticipatory grief, but also normalizing the grief process for the caregivers who think they should be all stoic and it's like, it's not me dying. And I'm like, no, but you're watching someone die a little bit every day. That is a trauma to you. And we should acknowledge it as that. And we should acknowledge that there's no way to get out of it, but there is a way to process it and to be able to manage it. And oftentimes our culture is so bad around death and dying that we just expect people to just suck it up and carry on. Like I shouldn't be having these feelings. I'm the caregiver. I'm not dying. I'm like, how could you not have those feelings? Both that you can't stand watching the suffering, but you don't want that person to die, or you would like them to die to relieve them, but then you feel guilty for feeling that way. So it's a very complicated situation, and this is the tool that we have is listening. It is the tool that works. Empathic presence, emotional support, validation of their feelings. Of course, they're going to cry. I had a guy come to a widow and widower's bereavement group, and his wife had died suddenly and tragically just 2 months before he came to that group, which, by the way, I wouldn't generally recommend that be his first bereavement support, but he showed up in the community. he couldn't stop crying the whole meeting. And then he felt horrible that he couldn't stop crying. I'm like, of course you can't stop crying. Your wife died suddenly and unexpectedly, and in an ambulance on the way to another hospital, and you weren't with her. Of course you're going to be crying. That is a trauma as well as a loss. And it's a tragedy in the situation that he was in. And he had just had open heart surgery, and he said, it should have been me that died. It was so complicated. And so most of my time with him was normalizing his reaction because he felt so bad about it. I thought, you got enough to worry about without feeling bad about your grief. Just do your grief. It's going to do whatever it does. Just do that. That'll be less burdensome than thinking you should be doing it differently. So the number one thing I tell people is that, grief has its way with you. We'll be here to support you. Don't judge. Don't judge yourself. Don't judge others. You don't know what's going on with them. So there are lots of theories about grief and loss. I don't like to make this clinical, but I like to be clinical enough so you know that what's normal and what's not normal. And normal is that word doesn't generally apply to grief, but in the sense of what will we be more concerned about in the grief process for people. So this one, I don't know if you can see here. So 4 phases of grief: shock and numbness, yearning and searching, despairing, disorganizing, reorganization, recovery. More or less in that order. Generally, when a patient first dies, that's where people are at. So in that time, I generally call someone 1 to 2 days after a patient dies, but I don't expect that to be a very fruitful conversation. I call to offer condolences, to let them know we're still here, even though they're not going to see any of us. Offer a bereavement visit, tell them about our support groups, and then say, how about I call you in a couple weeks, see how you're doing. And generally, I do that. A couple days, if you've ever had a loss, you're in a state where you can hardly function. You're not going to remember things.
I don't remember anything.
Yeah.
A few days after.
And I have many people who've said I went through the first year. I don't know how I got through that first year. I don't remember what happened. And so so we have to acknowledge that that's where they're at and not expect a lot from them. Usually, I'm asking them, how did it go? How are you feeling? Is there anyone you need in the family that needs help? What are your plans for a funeral? Do you need to tell me the story of how the person died? Or do you want to tell me about the plans? The one thing I like about funeral planning after a person dies is that it gives people something to do that's very concrete, and they can function. And at least I did that. I ordered some flowers, You got those cards with the pictures on them. I called the funeral home,
The deli plate's been ordered.
Yes,
From Hannaford's.
that's right. Whatever it is, those concrete things are things that make you feel like you have some control in life when something has happened that you have no control over. Yearning and searching. So this is the phase where I'm a little bit more likely to see people looking for help because we do such a poor job of this in our culture. Nobody understands. People understand people being in shock. And then I had people come to a bereavement group, and this one woman had lost her husband, 5 or 6 months, not a long time. And someone in her family said, well, why don't you just get back out there? Don't you just get back out there?
Oh.
Yeah, and it's like a 30-year marriage. And I was like, how ridiculous. But this is the thing. In our culture, we want people to be okay. We want them to be happy and okay and smiley and doing fine. So when someone asks you, how are you? And you say, how do you think I am? My husband just died. I'm horrible. I'm hardly functioning. And in fact, I can't keep myself from crying. And they're just like, okay, TMI, don't know what to do with that. So we don't teach people how to receive grief or teach people how to experience grief. So until someone has had that kind of loss and gone through it, then they have the compassion for other people. One of the bereavement groups, there was a gentleman who was a pastor his whole life, Episcopal pastor. His wife died. They were both elderly, I think married 60 years or something. And in the group, he was crying, not just because he lost his wife, but he said, I spent my whole career as a minister doing funerals, but never supporting people's grieving process. I had no idea. He had no idea what it was like. So he'd never had a loss in his life that close that he had to process it. And now he was processing it, and the regret for not recognizing that was what was happening with other people. Yeah, it was pretty intense. Despair and disorganization. What I find is that in the first year, so we support grief in the first year of someone after someone passes. In the first year, after about 6 months, they're probably about ready for a bereavement support group. Before that, one-on-one, a little bit of here and there, touch in, how are things going? About 6 months, they start to come out of that shock, and then they start to realize their loss. So that's actually a worse time to me than the beginning time. This is a fantastic psychological function to have shock. Fantastic. because nobody can handle all that grief at once. So I'm really grateful that our psyche does that. Just says, full stop. Ain't gonna be thinking about that. We're just gonna be moving through things. And then when that starts to thaw, that's when the real tough stuff starts. So people are like, I think I'm okay. My family's okay. And I say, you know what? Let's check in again. I don't want you to forget that we're here for you, because down the line it might feel different. The first year tends to be difficult with all the anniversaries and all, those kind of things, to try to prepare people for what that's going to look like. But essentially, there might be some time where you say, I thought I had this and I don't, and that's normal. So speaking normalcy into something that people are despairing about, like, why now am I upset about it? And I think the first 2 weeks after someone dies, a month maybe, people are all there for you, and then everyone disappears and goes back to their life. And like in the video, nothing is normal. Nothing is normal. So, you fall apart when you don't know why, where, you're at the grocery store and you reach for something that your loved one likes. And then you're like, I don't even like this. And now I'm in a puddle at the grocery store.
That's the biggest part. And I used to get really irritated with people when they would talk about, oh, it's going to be so hard at his birthday. Oh, Christmas is going to, that was nothing. It was the little thing. I'd be driving to work and then hear a song on the radio and I'd lose it.
Yeah.
Or I'd be hiking somewhere or skiing or somebody would laugh in a certain way.
Yeah.
Or order something at a restaurant. It's the random shit
just
that
touches
you
you,
not
right?
see coming.
Yeah. Yeah. And when, I've been divorced for some time, but after I got divorced, maybe a year after, my ex-husband's mother died suddenly. And my kids were super, super close to her, and they were little. My son was probably, I don't know, 8 or something like that. And my little one was, I don't know, that would be 4. So 4, 8, and 12, more or less. And when she died, my son he cried. He's a active kid, so he ripped up a bunch of phone books. That was his expression of anger at this, and like, don't know what to do. And then we made a little box with pictures and notes, and then he'd just walk across the floor, and all of a sudden he'd fall to the floor, and he'd be like, Grammy, and he'd just like fall apart. And it makes me teary now thinking about that little kid, so heartbroken. But so what I talked to him about is that grief is like you're walking on the beach, a tidal wave comes, it slams you down, it flips you over, you think you're going to die, and then it spits you out on the shore, and you didn't die. And that's how it works. And don't expect it to be different or kind or slow. It's going to get you completely unawares. You're going to get up, you're going to shake it off, you're going to walk a little further, and it's going to happen again. And then over time, it happens less frequently, maybe less intensely, but grief is the constant presence of absence. And that is the thing that sucks about grief, and it's also the thing that is the hardest about grief, is it doesn't go away. Once you've had a loss, it's a loss. So this process, however, we get our psychological lines in here and say, this is what happens to you. The experience of that, despair and disorganization, I don't know what my life is now without that person. Think of someone married 30, 40, 50 years, and then I don't know who I am without that person. And then there's a reorganization and recovery, or a new normal, or, I don't even know what you would call it. I don't even know what to call it. Just like the next part of life. I mean, it's not like everything's better, or you've come to terms with it, or you've moved on from it. That loss is a loss for the rest of your life. It will affect you differently in different parts of your life. It will come up in different parts of your life. It's just a fact of your life now. It's a fact. That's what I call it. The new normal, yeah. But then it feels like nothing's normal about it, right? Elizabeth Kubler-Ross is a famous psychologist who talked about grief. Actually, she was a doctor, but the stages of dying, or the stages of the grief process: denial, anger, bargaining, sorrow, depression, and acceptance. And these don't always go in this order. And there's been lots of research done after her. This was really the stages of dying, and it kind of got projected onto the stages of grief. You can see with patients who get a new diagnosis, this is like the shock, right? It's just shock. They're in shock. They can't process it. There's no sense in forcing that. We just have to like water on a stone, keep moving toward that. Many people get angry. Anger is an expression that is more life-enhancing than sadness is. Sadness can lead to despair, and so anger at least feels like you have some power. Bargaining, is there a way around this? If I'm a good person, God, will you give me more time? Whatever. And then there's a normal depression with dying and with loss. It's normal. So when people say, "Oh, this hospice patient is depressed," yeah, they are. They all are at some point going to feel depressed. Yeah, that's a normal part of that process. Acceptance, we can come to an acceptance that our end is coming. But acceptance is an interesting thing, because one day we can feel okay about this process, and the next day we can feel angry again or sad or any of these other things. So,
Really.
okay, all right. It's more, this process is more dynamic and fluid than the numbers indicate here. But they're all things to think about. So when you see a patient or you experience a patient who's angry, you can say, all right, this is not about me. You want to check yourself first. Did I do something insensitive? Did I not give enough information? Whatever. But then anger is just a natural part of this process. So people are going to be angry sometimes. We don't have to take it personally, and we don't have to, we want to apologize and say, I'm sorry you're so upset, because we are. I mean, it's not comfortable to be upset, but sometimes it's better than being sad for people. The tasks of mourning: to accept the reality of loss, work through the pain of grief, adjust to the environment in which the deceased is missing, find an enduring connection with the deceased while embarking on a new life. I like this description. So many people have an idea of something happening after death, and so then they can have a relationship, spiritual relationship, psychological or memory relationship with a person by going back to looking at things that they did with them, or by experiencing life events for themselves and for that person. Like sometimes people take that on and say, I'm going to experience life for both of us now. Or you can have a spiritual connection that you feel that person's presence. Many people feel the presence of deceased people. They feel their guidance or support or something like that. So recognizing that it's going to be a different relationship than when that person was in a body. And so that can happen in all kinds of ways, mentally, spiritually, emotionally, but it's not going to be physically, Although I've had people say, I smell my mother's perfume every once in a while. So there can be a physical manifestation of that for people. We don't have to have a scientific research that says that's happening. I mean, anecdotally, in 10 years of hospice experience, the number of people who have told me that they've had that kind of experience, I'm like, okay, people have that experience. Why do we need to do anything more than just say that's what happened? There's some kind of ceremony to apologize or seek forgiveness or whatever it is that they have. Tell them what they did that was harmful to them, So that's another strategy or theory of mourning. Another one has similarly, it's a avoidance, confrontation, accommodation, recognize the loss, react to separation, recollect, re-experience the deceased, relinquish old attachments, readjust to a new world, reinvest emotionally. I'm not so happy about this one, because that kind of says like, oh, you're going to go find someone new, or you're going to go on with your life when that person has died. It's so much more complex than that. When you were talking about soldiers earlier, there's a lot of survivor guilt for a lot of people. Why was it that person and not me, like that gentleman I was talking about? Or anyone, I think about as a mother, if one of my kids were terminally ill, I'd be like, God, let that be me. I've already lived. Let it be me whose life ends instead of them. Any number of things that happen that we can't make good sense of it, because it's a fact of life and a process that we don't have control over. What we have control over is how we're going to address it in ourselves. And the level that you address it in yourself is the level you'll be able to address it in other people. So if you have losses that are recent or very sensitive, it's important to do your own process and get help with it if it's burdensome to you, because you won't be able to help other people with it. As soon as they touch on that level that you're at, you will not be able to help them anymore. You'll have to step away and be like, I can't do that right now. So it's important as clinicians to make sure your internal processes are in good order. Not to say that you're going to rush grief if you're in grief. There's no rushing it. It's going to have its way with you. It's going to take its time, whatever time it takes. But when you feel sensitized personally, that's when you have to say, I need to get somebody else in here to help with this part. Does that make sense? Mm-hmm. So these are all just theories. Grief is not linear, and stages can repeat themselves. There's no end point to grief. I do have a handout that I give in the grief group, 64 things I wish someone told me about grief. And that has to do with giving yourself permission to grieve. Like, I don't have to answer everyone's calls. When I go to an event, I drive myself so I can leave early. Just all the things that it's normal to feel this way. It's normal to be angry at the person who died. It's normal to be angry with God. It's normal to wish it were you and feel bad that it wasn't. There's a lot of things that we don't recognize as part of the process, and so then we just feel bad about them. People apply coping strategies throughout their lives, and grief is another area where we need coping strategies. Emotional and relational expressiveness, talking, sharing, crying, yelling, those are all good things. Externalizing the feelings that we have. A lot of cultures have very active grief culture. They cry, they keen, they wail and weep.
They have the Day of the Dead.
They have the
parades. And
yes.
They hold vigil, and they camp out at their graves.
Right. They make it part of their life. And in a Eastern Asian country, I forget where it is. I want to say it's the Philippines, but I might be wrong. They actually keep the body in the home, and they, for a year after the person dies, that body goes from the bed to the table to the chair, like it's part of their life, same as it ever was. And it becomes this little shriveled up, like apple doll kind of looking thing. I know. Well, I'm sure there is a part with, I'm sure they do something about the deterioration process, but it basically gets dehydrated, and then they're moving it around. And then, maybe they do some process that's preserving. I don't know, but it's not like embalming.
We can.
What's that?
The year of the
Right, and then eventually there's a place where the body goes, or they have a cremation, a burning type ceremony. So every culture has its way of making this process have cathartic moments that make the process move along. It used to be when we did, the European way of having like a 3-day wake in the home where everybody comes together. It's a very therapeutic process for everybody. And I don't really like the word closure, but there is some benefit to having an event. That's why funerals are important. When people tell me, oh, I don't want any funeral, I don't want any memorial service, I say, well, that's good for you, but it's not good for anybody else. They're going to cry, get over it. They're going to need to have some processing time. They're going to need to remember you and respect you. And that's part of the internal process. We need to give people the chance to do that. And if someone says, I don't want anything, then I say to the family, they don't want anything. That doesn't mean you can't do something on your own after, have a family gathering of some sort, whatever. Whatever you need to do. So coping also is when you have other things in your life. So for people, elderly people who they were pretty much taking care of each other and one of them dies, that was their life. That was their meaningful activity. Caregiving is the meaningful activity if you're a caregiver. So that's a huge change for people, and they have to imagine their whole life. Similar to when someone gets a divorce, you're like, okay, I had this plan, and now that's not happening anymore, and so now I have to have a whole new plan. Maybe a new location, maybe new friends, maybe new financial situation. Spiritual and religious practices are very helpful, and then the services, writing letters, having pictures. So this little box we did for my mother-in-law stayed on our coffee table for about 6 months, and the kids would look at it periodically. They'd put little notes or pictures or little things in there, trinkets in there. And eventually it went to the bookshelf, and then it went to one of the kids' rooms, and then pretty soon it wasn't the center anymore, and it was a kind of organic process that just happened, and it worked out fine. And my kids, although they still love their grandmother and they miss her, they're adjusted to a life without her that is healthy, and they love her. They remember her in very particular ways. She was a great cook, and they cooked food that she cooked, and she had a special number that they keep in their minds. And so it's really nice to see that they've come full circle, even for children to incorporate that into their adult life. So for bereavement, they get a call from us. Someone attends a funeral. Generally, we send out a bereavement card, which we usually keep in Darlene's office, and we'll be sending out an email to everybody. So if you had any, if you cared for that patient on home care or something, you can sign the card for them. There are bereavement visits, up to 3 visits that we do for counseling, so to help people work through that grief. If they get to the point where they need more than that, we generally refer them out to the community, and we'll talk about why someone might get to that point. That would be a more compounded or complex bereavement process. We have letters that we send them every 2 months over the course of 13 months that are just kind of reminders. We're still here. Here's some more tips about how to get through this. Their drop-in bereavement group, and now we have the widow and widowers group at the senior center twice a month. We assess for complicated bereavement and do grief treatment and or refer to professionals in the community. So when a patient passes, we do that initial bereavement assessment, and then after someone passes, we do a final bereavement assessment and say, what is our plan? So the plan is has to do with, are there family members who are at risk, and what are we going to do for them going forward? And then we have a bereavement plan, and when Medicare audits us, we have to show that we have a plan and what we're doing to follow through with that plan. And then we have some bereavement volunteers who would make calls and visits. If we have a volunteer with a family and the patient passes, we ask them to make a call and or visit, just to kind of have some continuum for them after the patient passes. And then we have our memorial service, which we did in September for all the people who died in the last year. In our team meetings, we sometimes do something that's more, interspersed. If we have several, like when we had the 8 people pass, we did a little something that was just to help us touch in, like that's a lot. I can read this. I offer yet another impression of normal grief and complicated grief. I approach all grief reactions as a complication in the life of the individual who seeks help with this human phenomenon. We travel life's roadway, and suddenly, around the bend, the bridge is out. A death, a life-threatening diagnosis, accident, layoff notice, or other traumatic change has painfully altered the course of our journey and requires a new way of looking at life. The process of grieving represents a disruption, a need for altering our direction, our plans, and how we identify ourselves in the post-loss, changed world. Normal grief presents many complications and deserves the help of a care provider who is an exquisite witness. People who are grieving deserve care at whatever level their situation requires, whether we call it complicated or not. At all times, individual differences must be taken into consideration when determining how we, as care providers, will serve them. So, in our culture, we generally, I don't know what we get, 3 days off if someone close to us dies. And we're not hardly walking at 3 days. We certainly aren't thinking or able to concentrate psychologically. It is just ridiculous that we have, and then if it's someone who's not, related to you by marriage or blood, you don't get any time off, right? So I have a friend whose partner of 4 years died suddenly, had a heart event and died suddenly. No time off from work for that because she wasn't married.
Oh my gosh.
I mean, she took time off,
Yeah.
of course.
Yeah.
But, people can lose their job. Like it's really serious, and it's not taken seriously. What does 3 days give you? Nothing. If it's a close loss, you can't. I don't know why people would want you back at work, because you can't function. You're not going to function well. So, and it's brutal to not give people the time for that internal process. Just because you can stand and walk and eat and say hello to someone does not mean you're functioning on any level. So the when people move into bereavement, as Steph was saying, we have such a small community. We see people all the time. I was at Walmart, came around the corner with my cart, and there's the wife of a patient. And she looked at me and she said, "It's 6 months today."
Oh.
And I was like, "I'm sorry, just grocery shopping," And of course, I supported her, and and she was okay. But that's the kind of thing that happens. You're going to see people, and we're part of their lives. Pemmy Baker's part of their lives. They've been coming here for the pool, and then their loved one dies, and then they're on hospice, and their grandchildren have a well baby visit. I mean, we're it for them. So if you make the choice to live in the community you work in, which I did, which I might not recommend in future to people, like I literally go to the grocery store late at night so that I
In a disguise.
In a disguise, yes. If you see me there, my rainbow. And it's not that I don't want to see them. It's just that I have to have downtime too, and that's why I have to make a boundary that makes it I'm not quite so accessible to people. I go to the coffee shop in town. Invariably, I see 1 or 2 people that we've cared for in some way. So that's a beautiful thing, and it's a burdensome thing at the same time. So I underlined exquisite witness here, and that's really the key of bereavement support, is just being a witness, not judging, not thinking someone should be further along than they are, helping them normalize that wherever they're at is just where they're at, and being hard on themselves only makes it worse for them. They don't have to be hard on themselves. It's just what it is.
So when would it be, like, I had a friend in high school, I was best friends with the girl, and her father died, and then a year later her brother committed suicide.
Oh, horrible.
And nobody saw that the son,
Yeah.
was in so much distress because everyone else was so in shock themselves.
Right.
Like the mother was depressed.
Yeah.
And he was a teenager. He was only 16.
Mm,
But so when is there signs when
Yeah.
someone's not doing
we're going to
well?
get to those right now. Complicated or compounded grief. So sudden traumatic or violent death, always a trauma. So someone dies suddenly, that is automatically complicated grief because it's a trauma. On top of the grieving, there's a trauma. So I don't know if the dad in that situation died suddenly.
Cancer, no.
Okay, so he had cancer. And then because grief isn't well supported, people think something's wrong with them if they're grieving, then they don't get help for it. So yeah, watching for the signs. Multiple losses, unresolved relationships, certainly for children, children and young people, teenagers are going through enough emotional angst as it is. To help them go through grief, you have to have there's a lot of emotions going on. It's a really great book called Fire in the Belly, Ice in the Veins, or something like that for teenagers, just about the intensity of grief and loss and the existential intensity. They're already trying to deal with what's the meaning of life, and then someone dies, and they're like, now I don't know what I'm doing, and now I'm desperate, And of course, teenagers are impulsive, so that desperation can easily turn to self-harm in some way. Financial strain around here is a huge thing. People, they have their loved one die, then they have to sell their house and move, and they have nothing because they relied on that dual income. Close, conflicted, or ambivalent relationships. So a close relationship can be devastating. An ambivalent relationship can be devastating for different reasons, of course. Loss of a child or long-term marital partner. They have specific things. Suicide, loss by suicide. Specific. There's a lot of different kind of grieving that happens. A lot of guilt, a lot of anger, a lot of wishing they had known or could have done something, or there's a huge process there that's different from losing an elderly person or losing a spouse or losing a child. And there are across the state support groups for those things. In this area, it's very hard to get a specific support group. We started the widow and widowers group at the senior center because we found that need was pretty big. But even that, we have 4 to 6 people come to any of our groups. Not very big. Even though everyone needs it, the older generations are less likely to seek help and more stoic about it, but they certainly need it just as much. Any pre-existing emotional state is going to be complicate grief. Coping and resiliency strategies. People will say, I'm good, I don't need help, I'm good, death is inevitable, whatever. And then, of course, they're still having a process. And so that kind of front, I never fall for that. I'm like, all right, well, I'll check in with you in a while. And sometimes people are stoic, and sometimes they've had experience where they really do have it. Like I have someone die, I know my internal process, I'm going to monitor it. I know what it looks like if I need help. I'm going to get help when I need it. So if people were to come to me and say, how you doing with that? I'd just be able to tell them honestly. And if I say I'm okay, I'm okay. If I say I'm okay today, today's an okay day. That's true. But other people, they say, oh, I'm all right. They're trying to make you feel better, or they don't have a handle yet on what's happening because it's so amorphous, that whole grief thing where you're kind of in a fog. How do you know, like in your situation where you say, how do you know that kid needed help? If that were me, I was working in hospice when my mother-in-law died, so I did things right away. I got my kids into a children's group. They each needed different things. I made sure that one of them could talk to her school counselor. The other 2 went to this group. We did this thing at home. It was very complicated. We're in the middle of a very bad divorce, so my older daughter is not biologically of that family, and so she wasn't invited to the funeral. That was a whole nother mess that made it really bad, and so I had to work with her on other things. So it was very complicated. Thankfully, although my heart was crushed, I knew what to do that would help them, and they've each resolved that in themselves. But how do you know what to do, or how do you know when someone needs help? Everybody needs help. That's what I would say to that. And even if they say they don't, I would say my daughter, she was 12. When she found out, she left my house and went next door to her best friend. And that was how she dealt with it. And her and her friend, she had a loss too, and they worked it out. And I monitored. I was like, do we need anything else here? And she did come to terms with it. Not to say she didn't struggle, and not to say she didn't have a lot of pain, but she had the support that she needed. And then the other kids, they were much younger, so I, provided them the support. Can you anticipate and prevent? You can anticipate. You can't control. You can't control. Like, even if I provide all the right things, that doesn't mean that person's not going to have a moment where they can't stand the pain of it. I mean, I have a short list of things that I'm going to talk about across the table from God. And one of them is, what the hell with grief? Like, why don't you just kill us? Because that is torture, And what I found over time in my own process of having grief is that the good side of grief is that it makes our hearts more available to other people. It makes us more compassionate and softer and a better advocate for people who are grieving, more accepting that people are going to have whatever reaction they're going to have. It is a tragedy, of course, when someone takes their life, because we would like to think not just that we could prevent it, but that they were in so much pain that we wish we had known that they were in so much pain. It's often the case with people with suicide, though, that people don't know they're in pain. They're trying to be strong for everyone else. Mom's depressed. I have to be the man of the family now. It's a lot of pressure. Maybe they didn't, have access to or use well or figure out a way in their young mind to come to terms with that.
No, that was before. This was in like 86.
Yeah.
And they didn't even talk to school counselors.
Right.
Like no one talked about it.
Yeah. And so I think it's gotten better, but then again, I work in the death trade, in the grief trade, so I'm around it all the time. So if someone I'm concerned about, I'm going to make sure they have information at the very least. I find in grief counseling, though, in our culture, the number one thing I have to do is normalize it. Just tell people it hurts, it sucks. Yeah, you're not getting out of bed. Yeah, okay. Now, if you don't get out of bed for 3 weeks straight, now I'm going to worry about you. Let me see if danger signals. That's what I want to get to. So if someone has suicidal ideation or plans, obviously danger sign for grief. If they have self-destructive behaviors, often people, like in my family, the cure for grief was drinking. Anytime someone died, everybody got drunk. The whole family got together, a big drunk fest,
Irish?
cry, and English, Irish, Polish, whatever. Anyway, a bunch of people got together, they drank, they cried, they told stories, they laughed, and then they got on with their lives. That was the way they did it. Is it self-destructive? If it keeps going on and on, yes, it is. But in that moment, that's a coping strategy. Severe mental disorganization. You see somebody who really just can't function. That's going to be a sign. Feelings of guilt, regret, or low self-esteem. Those are signs. Someone has I never got to tell them. I never got to say I'm sorry. I feel like it was my fault. I killed them. Whatever. Their death was my fault. It was suicide. Those are big flags.
The last words that my best friend Kim said to her brother was, "Get away from me, I wish you would just die." He left the house, drove until he ran out of gas, and pulled over and shot himself.
Yeah. It's unfortunate. I mean, people are in pain, and so they're saying
they were all in pain.
Everyone's in pain, and then it's like, I can't take any more pain.
Yeah.
I can't take your pain.
Right.
And so that's when someone from the outside has to come in and help, because if you're all full of pain, you don't want to put that on other people, but you just can't take anymore.
Right.
And that's the same as compassion fatigue. You can't take anymore. So I can't do another bereavement group. I can't go home and have to have a glass of wine and cry before I go to sleep because of my job. Okay, I can't do that anymore. I gotta take a break from that,
Yeah.
And now I can do it, but I'm still super sensitized. Like, I go do it for Guy when he's not around. I'm like, okay, I'm gonna take a big breath here, and I'm gonna be okay. But I know that about myself. I know that I'm at almost maximum capacity, so I have to be careful with that. I have to tell my friends, who all know that I work with death, when they have deaths, I'm going to be there for you. And then when we're out in a random Saturday doing something, you can't talk to me about it. You just can't. Like, I can't do that for you and be your friend. Like, I gotta be a person sometimes. I gotta have a glass of wine, dance, sing, go see music, something besides talking about the hard stuff in life. I know I'm your friend, but I can't take that too. Like, sometimes it's gotta be a not on duty. If someone's continually irritable or having violent outbursts, that would be a sign. Unless they're just crotchety, and then that's they're crotchety. Okay, that's that thing. Radical, sudden, or shocking changes in lifestyle. This is one thing I recommend people, and recommended. People don't make huge changes in the first year. People will sell their house, get rid of all the stuff, move away. That's an avoidance strategy to escape the situation. It does not escape the situation. Usually ends up in regret for not having been more thoughtful about what you kept and didn't keep in your connection to a place and people. So that's not a great one. I see that happen. My ex-mother-in-law, her husband, my ex-father-in-law, I think he got married within 6 months of that death. Not a good idea. I'm not sure what woman would think that was a good idea to marry that guy when that happened, but Not a good idea. And then physical symptoms that can imitate that of the deceased person or can be stress-related symptoms. So those are all the things that you'd be watching for. So if you see this before the death happens, that's one thing. You see someone in the community and you say, oh, that person's husband died on our service and they were doing okay, but now this came up in the conversation, something was funny, or, you know, you can say to us, hey, can you reach out to that family member? You know, and I kind of do this instinctively. If I think of somebody, I just give them a call. Like, hey, I've been thinking about you. How you doing? Or I see them in the community, and the guy I told you about the motorcycle, I saw his wife at the voting polls, and I gave her a big hug, and I was like, hey, how are you doing? She's like, oh my God, I can't believe this was before the memorial service. She was coming to the memorial service, and she's like, I miss you guys. And I'm like, I know you do. And she's talking about Jan, the nurse, who was their nurse, and, you know. And so I said, well, next time I'm out on my bike, I'll stop in again and say hi. Don't forget me. Yeah, she's very nice. But she lives alone. You know, she has limited resources. She also has a daughter who's sick. Like, she's got a lot going on. And I can't fix everybody and be everybody's, you know, friend. But I can get them more information if they need it. Okay, we'll wrap up. Cumulative grief is when you've had more than one loss. Anytime someone's had more than one loss, especially if they're close together, they don't generally have time to process one before the other one comes along. That is going to get complicated and compounded over time. For us as hospice workers, we're going to have cumulative grief because we have, you know, 50 to 70 deaths a year. Time's not the only factor in cumulative grief. It depends on the relationship you have with those people, how important it is. Substance abuse can increase the risk for cumulative grief, or cumulative grief can increase the risk for substance abuse because that's a way to not feel, right? Age can increase it, and grief is unique as each person that we lose. You can't rush grieving multiple losses, and it's not going to be the same grief. You know, people say, well, I've had another loss, I know what to do. Well, not necessarily. This couple, the Steph was talking about this couple that we took care of the wife. She died a couple of years ago, and then we took care of the husband. The daughter said, I had a tough relationship with my mom, and that was really hard grieving for me. I think this will be easier. But then when I saw her at the funeral, she said, I'm much closer to my dad. It's not going to be easier. And so, you know, we just don't know how that's going to go. And then, so grief support versus grief comfort. Comfort is a state of physical ease and freedom from pain or constraint to make someone feel less unhappy or console them. Support is to help bear all or part of the weight of their burden. So we are bereavement support system, support group, support services. Comfort's what we do when we see someone we know who's had a loss. We hug them. We say, hey, I'm sorry. We try to make them feel a little better. We're not trying to make people feel better. We're trying to unburden them by receiving their story, by getting them to feel like this is a normal process, by helping them to get the supports they need to get through it emotionally, and also like a validation of the process for them. That's what supports people in grief. Certainly we're going to comfort them as well, but what doesn't help is saying things like, well, at least this, or you can always, or they're in a better place. I know exactly how you feel.
Was it meant to be?
Yes, and so you would never say that unless the person said it to you first. Unless the grieving person said it to you first. Well, they're in a better place. And I say, well, I'm glad you feel that way. You know, that brings you comfort to feel that way. But these are minimizing grief, things that people say to minimize grief. And basically it's so that they can feel comfortable, not the grieving person. But, you know, if you're saying that, you want to feel comfortable. If you're recognizing the horror, you know, we had this unfortunate tragedy this week in our staff here. That's a horrible thing. We would never want to say anything like this. We just say, oh my gosh. The best thing to say, I just don't know what to say. I'm so sorry. You know, like that's all we can say when people have a horrible loss. Is there anything I can do? You know, show genuine care and compassion, provide concrete assistance if possible. You know, can we do something for them? Listen and be present. That is what we have to offer in grief. And it's also what we have to offer in dying, because dying and grief are inextricable for both the patient and the family. So that's the feel of that. And even though if you come to our IDG meetings or if you talk to us, a lot of what we're talking about is the process of dying and the symptoms, and et cetera. The bigger picture that I really want people to keep in mind is that this whole thing that we've talked about today is what hospice is. It's dying. It's not just symptom management. and or not just listening. It's dying, and it affects us as clinicians. It affects the patients and families, and we're in it together. We got to take care of one another. We got to take care of them, and not rely on them to take care of us. And then if you're getting to the place where you're like, this one's too close to home. I have difficulty with people my own age, people dying that are my own age, or have children. But a younger person it's more struggle for me. We don't do children's hospice. We've done a couple, but we don't generally have children on service because most people are trying to do everything they can up until the very last moment with children. So we don't have very many children that we take care of. Those would be hard for many people.
I had a 21-year-old that died last year, and I was so happy I wasn't there for her final death because I was just like, oh boy.
Yeah.
And the hardest part was seeing the parents so
Strong.
distraught.
Yeah.
And then she did not want to die.
Yeah.
And so it wasn't like I've lived a long life, I'm 90-something years old. It was like I don't want to die, and it was happening.
It's happening anyway.
And
Right?
so she was fighting it so
Yeah.
hard, and so she didn't go down quite so easy.
Yep.
So that was
Yeah.
that was hard.
Right. Yeah, it is hard. And those things leave you with some trauma, and that's something that we all have to work on. People generally don't last forever in hospice work because it's easy to get burnt out from that kind of pain of watching people suffer.
And the bad part about it was she had brain cancer, so she was starting to have seizures,
Oh,
and it was really hard for the family to watch it.
of course, yeah. So, yeah,
Because they were just nonstop.
yeah. And those are the kind of existential things you're like, why?
I know. It's like,
When my uncle died, I was like, really? He died on the day my friend was out in Ohio going to her father's funeral, and he went into the hospital. He died the same day of the funeral. She had to go from the funeral to the hospital, and then he had died. He wasn't expected to die, and he had a heart event and died. And so I'm like, he had died. He wasn't expected to die, and he had a heart event and died. So I'm like, wow, that's complicated grief right there. Away
Yeah.
from home, the father's funeral, he dies unexpectedly.
Yeah.
Compounded and complicated grief all over the place.
Yeah.
She's done a great job of dealing with it. I mean, of processing it, but still, that was like, wow. And people have a lot worse deaths to contend with, but that was a tough one.
Mm-hmm.
So thank you for your attention,
Thank
and I
you.
hope this was helpful to you. And
Yeah.
I like that we had the time to really what do you call that, marinade in the feeling of hospice, so that when you're out there, you can be remembering, yes, your nurses and your hospice workers. And we'll be doing some more things that have to do with hospice and palliative care and how it works in our community. So when we have some in-services in October, November, we'll look a little more closely at that. I hope that gives you and please come into my office anytime you have questions about logistics or whatever, if you're seeing patients for us and, pronouncements. I know you've both done them before, but if you're on call and it's getting, you want to talk about we try to send out emails ahead of time and say this person's declining, there could be a death. So let you know that someone's imminent, but sometimes that doesn't happen.
Yeah, so you can have your death certificate in your bag.
Yes, right.
Yeah, like
Yeah.
have all the things, like
Right.
get ready, like look the night before, where do they live?
Right.
How far out is it gonna be?
Yeah.
Who's the funeral director?
Yes.
Do I have their number programmed into my phone?
Yes.
Do I have cell service?
Yeah.
Right?
And
All those
families will
things.
generally have a landline if there's no cell service.
That's
So
good.
when you're in the home, you can use their phones.
That's good.
Well,
We
like
do
all
have quite a
those
number.
things.
No, there's a lot of things to consider doing home care.
Sure. Yeah.
Was there something else? No. Okay.
So at the end of all of our so we're gonna continue with our hospice training, and then we'll get our certificate.
Yeah, so what I have created is a check sheet. So what I'm gonna do is put down the names of the people who came today, and then I have this hospice orientation check sheet for nurses. And so I'm gonna keep these with Danielle and keep track of what you've done. And then when we get to the end of it, we'll all sign off and put it in your HR file. And then this is required by Medicare also to have a certain amount of training. And I think this is a good amount. I just created this one. I'll get you copies of that, and we'll work on keeping those together. Okay? Over the next month, we'll hopefully get everybody through that. Anything else for you?
I'm just stretching.
You're just stretching, as we all need to now.
Yes.
Thank you. That was long, but I think I covered a lot of ground.
Very good. And so you're gonna go out with Dory, and you're gonna go meet Kara.
Yeah.
After your lunch, okay?
Business